What the Study Says.
Welcome back to What the Study Says. I'm Dr. Kai.
And I'm Dr. May. So today we are wading into what might just be the most expensive section of the supplement aisle.
Oh, I think you're right about that.
We're doing our deep dive on hyaluronic acid, HA. For years, we've been told it's the body's own secret sauce.
The miracle molecule.
Exactly. The stuff that keeps our skin plump and our joints, well, gliding. But here's the million-dollar question, the one you're asking every time you see that $80 jar. If HA is this huge molecule and our supply just dries up as we age, can simply swallowing a pill actually reverse the clock on your skin and fix your grinding knees?
And that is the central paradox we are tackling today. We've gathered the hard science, we're talking placebo-controlled trials, meta-analyses, to really see if oral HA supplements can deliver.
Not just marketing hype, but real efficacy.
Exactly. For two very different problems. Skin aging and, of course, degenerative conditions like knee osteoarthritis.
Okay, so before we get into the trials, let's start with the absolute basics. What exactly is hyaluronic acid?
At its core, it's a glycosaminoglycan. But a simpler way to think of it is as a super sponge.
A super sponge, I like that.
It has this incredible, almost unparalleled ability to bind and retain massive amounts of water. You find it concentrated in the synovial fluid in your joints.
The lubricant.
Precisely. It provides lubrication and shock absorption. And it's also a huge component of the dermal layer of your skin, which is what gives it tension and hydration.
Right, and as we hit middle age and beyond, that supply chain just kind of breaks down.
It really does. Both the amount of HA and, critically, its high molecular weight, they decrease significantly.
And that has direct consequences.
Absolutely. In the joints, the fluid loses its viscosity, it gets thinner. That leads directly to friction pain. The classic breakdown you see in osteoarthritis or OA.
And on the skin.
It's a similar story. You lose that tension, that hydration. And the result is dryness and, well, wrinkles.
Okay, that perfectly sets the stage for why people are so desperate for a solution. So let's start with the joints. We have to acknowledge the gold standard first.
We do.
The intra-articular HA injections directly into the knee.
Yes. And the evidence for those is very, very strong. It's been accumulating for years. In fact, major organizations like ETHEO in Europe recommend it as a second-line treatment.
So after things like NSAIDs fail.
Exactly. When the first line of defense isn't enough, this is a robust next step.
The data on efficacy is really compelling, but how does it stack up against, say, a steroid injection? They're also common.
That's a great question, and it comes down to the duration of the benefit. Corticosteroids give you fast, early relief, no question.
But it doesn't last.
It doesn't. The research shows that HA injections have a greater and much more sustained effect beyond that 12-week mark. The benefits can often last 6 months or even more.
Wow. And what about the big picture, the long-term impact?
This is maybe the most important finding. Real-life studies suggest that repeated courses of these injections can actually delay the need for a total knee replacement.
Delay major surgery.
By about 2 years, on average. For a patient's quality of life, that's just monumental.
That's incredible. But it's not just mechanical, is it? It's not like you're just squirting oil into a rusty hinge.
That is the key distinction. The action is twofold. First, yes, you have viscosupplementation, that immediate lubrication.
The oil in the hinge.
Right. But the more powerful long-term action is what we call pharmacological reestablishment.
What does that mean?
It means the injected HA actually triggers your body to start producing more of its own HA.
Yeah.
It helps restore the joint's natural balance, its homeostasis.
Okay, so that's the needle, the established science. Now, let's pivot to the supplement bottle, oral HA.
The new frontier.
Right. If injections work locally, how can swallowing a giant molecule even compete? Is there any real science showing a benefit for joints?
There is, and it's significant, especially for short-term symptom management.
Okay.
Recent placebo-controlled trials, good ones, found that oral HA was associated with clear, measurable improvements in pain scores, in functionality, even in range of motion. And this was within 60 days.
60 days is pretty fast. But I want to zero in on something you mentioned earlier about other drugs. What's the impact on medication use?
This is where it gets really important, medically speaking.
Uh-huh.
That symptomatic improvement was directly tied to a significant drop in the use of what we call rescue medications.
So NSAIDs and other painkillers.
Exactly. And given the serious risks of long-term NSAID use, we're talking GI issues, kidney damage, cardiovascular risks, reducing a patient's reliance on those is a massive win.
So it's not just about feeling better, it's about reducing systemic risk from other drugs.
That's arguably the most important outcome.
Okay, but we have to tackle the absorption puzzle. HA is enormous. I mean, conventional thinking says swallowing a molecule that big is just pointless.
And that conventional wisdom is being overturned. We're learning more about the gut microbiome.
So what's happening?
The HA gets decomposed. It's broken down by bacteria in your small intestine into much smaller fragments.
Wait, so the body doesn't absorb the giant chain itself?
No, it absorbs these little broken down pieces. They're called 2,6-membered polysaccharides. They're bioactive.
Bioactive fragments. So how do these little fragments travel from the gut all the way to the knee and have an anti-inflammatory effect?
It's a fascinating systemic mechanism. One of the leading theories involves a specific receptor on your intestinal wall.
Okay.
It's called the toll-like receptor 4, or TLR4. The high molecular weight HA binds to it.
And that binding does what?
It acts like a signal, telling the body to ramp up production of anti-inflammatory cytokines, specifically something called interleukin-10.
So, let me get this straight. The HA doesn't go directly to the knee to rebuild the fluid.
Not necessarily, no.
It's triggering an anti-inflammatory cascade that starts in the gut, and that cascade is what benefits the arthritic joint far away.
You've got it. It completely challenges our old models of supplementation.
Yeah.
It's proof of a systemic gut-joint connection.
Wow. Okay, so let's connect that systemic action to the other huge reason people buy this stuff. The beauty equation.
All right, skin health.
If it's working on joints from the inside out, what does the hard science say about oral HA for your skin?
The clinical evidence is surprisingly consistent here. A recent meta-analysis pulled together all the data, and it found statistically significant improvements in skin hydration, skin elasticity, and critically in the depth of fine lines and wrinkles.
Okay, let's get specific on wrinkles.
Yep.
If I start taking this, how quickly are my crow's feet actually going to shrink?
We have data on that.
Yeah.
A double-blind, placebo-controlled study looked at exactly that, the crow's feet area. Subjects took 120 milligrams a day for 12 weeks.
And the results?
The group that got the higher molecular weight HA showed a significantly diminished wrinkle volume compared to the placebo group, and that was after just 8 weeks.
8 weeks. That's a quick turnaround for a supplement. And you said volume, not just appearance.
Measurable volume reduction, yes. And the subjective reports lined up perfectly. After 12 weeks, subjects said they noticed big improvements in skin luster and suppleness.
So they could feel the difference, too.
They could. And other studies focusing just on hydration found similar results, showing improved skin hydration within just 2 to 8 weeks.
And what's interesting here is how broad this seems to be. Was it just for one age group or one skin type?
Not at all. The hydration benefit was validated across young women, we're talking 18 to 35, and also in an older group, 45 to 65.
And skin type.
It worked for dry, oily, and normal skin types. In fact, for the dry skin group, they saw a measurable improvement the earliest, after just 2 weeks.
Wow.
And with long-term use, after 12 weeks, they also saw an increase in epidermal thickness.
So it's literally making the skin barrier stronger from the inside.
That's what the data suggests, a healthier, more robust skin barrier.
Which brings us back to that molecular weight question. For topical creams, everyone talks about low molecular weight for better penetration. But if you're swallowing it and it gets broken down anyway, does the starting size even matter for skin?
That seems to be the elegant conclusion of the research. For skin health, studies show efficacy from both low molecular weight HA and the higher ones.
So it doesn't matter what you start with?
It appears not. Since the key is that interaction in the gut, breaking it down and triggering that systemic response, the size of the raw material you swallow isn't the determining factor for reducing wrinkles or improving elasticity.
So let's synthesize all this. When you put it all together, what are we looking at?
The overall picture is, well, it's robust. The data confirms oral HA is a safe and effective part of a multimodal plan.
For joints.
For joints, it offers short-term relief from mild to moderate OA. It could be a protective measure for healthy joints under stress, and most importantly, it can help people reduce their reliance on risky NSAIDs.
And for skin, it sounds like the cosmetic promises are actually backed by clinical data.
They are. We're seeing statistically proven improvements in hydration, elasticity, and fine lines, working from within for all ages and skin types. It's delivering results that a topical cream just can't.
Okay, so this brings us to a final thought for you to consider.
Given this really compelling evidence, the question isn't really whether oral HA works anymore. The science strongly suggests it does.
Right.
The question now is, for which specific person are you trying to maximize that benefit? Is it for the middle-aged runner trying to protect healthy cartilage? Or Is it for the person prioritizing that deep systemic hydration and wrinkle reduction? Where does this tool fit best in your wellness routine?
That is a great question to think about as you navigate the very complex world of supplements. Thank you for taking this deep dive with us today. If this information gave you the clarity you needed, please subscribe, leave us a review, and share this deep dive with anyone curious about the science of keeping those joints lubricated and that skin plump from the inside out.